Hello, Samantha.
Hi, how are you?
I'm good. I am Nurse Brock. I'm going to be giving you a report on Miss I'm a Mom today.
Okay.
She's 31 years old. She's 2 days postpartum. And we're going to go over some of the things you're going to need to do for the postpartum data collection.
Okay.
Okay? So the postpartum period begins 1 to 4 hours after delivery of the placenta, and it ends approximately 6 weeks after birth. So the greatest risk factors for postpartum are hemorrhage, shock, and infection.
So those are the things that I should look for.
Those are the things you're going to need to look for, yes. So the assessment you're going to need to do, or the data collection, is called the bubble assessment. The B is for the bubble assessment.
Oh.
It's for breast, uterus, bowel and GI function, bladder function, lochia, and episiotomy. So for the breasts, what you're going to need to do is monitor for any redness or tenderness, any cracked nipples, or indications of mastitis. Mastitis is an infection in the milk duct of the breast with flu-like symptoms. Okay? So what you're going to want to do is encourage early breastfeeding. It also stimulates oxytocin and helps prevent hemorrhage.
Okay.
Reinforce the client the importance of proper latch techniques to prevent nipple soreness. Important things to remind the client are to wear a well-fitting bra.
Okay.
And for clients who are lactating, remind them to completely empty their breasts. Okay? For the uterus, what you're going to want to do is check the fundus. So you're going to want to check the fundal height.
Now, how do I do that?
Oh, that's funny you should ask. So what you're going to want to do is put gloves on, cup one hand just above the symphysis pubis, and then use your other hand to palpate the client's abdomen.
Okay.
This is going to help you locate the fundus. So then, once you do that, you're going to want to document the fundal height, location, and uterine consistency. You're going to want to monitor for hypotension and for hypertension. And for client education, again, remind them to start breastfeeding early for those who are lactating. Again, preventing hemorrhage. And encourage them to frequently empty their bladder every 2 to 3 hours to prevent uterine displacement. Okay? Next is you want to observe their GI system and their bowel function.
That's very important.
Yes, it is. So what you're going to be collecting is information on their appetite following the delivery, any constipation with bowel evacuation delayed until 2 to 3 days after the birth, which is common. Also for hemorrhoids. And you're going to want to monitor for reports of hunger, check bowel sounds, like you do on every patient, you know the drill.
Right.
Spontaneous bowel movements might not occur for 2 to 3 days after delivery, so just keep in mind that's normal.
Okay.
Observe the rectal area for any hemorrhoids, and then administer stool softeners as needed. It's important to remind the client to eat a well-balanced diet with adequate fruits, vegetables, high-fiber food sources, and fluids. Also encourage the client to ambulate. Early ambulation is very important. And then next is the urinary system and bladder function. So for what you're going to collect here is any urinary retention secondary to loss of bladder elasticity or tone resulting from trauma, medications, or the anesthesia. A distended bladder is a result of urinary retention and can cause uterine atony and displacement to one side, usually to the right. The ability of the uterus to contract is also lessened. Postpartum diuresis with increased urinary output begins within 12 hours after delivery. So some things that we can do are determine the client's ability to void every 2 to 3 hours, observe the client's bladder elimination pattern, again 2 to 3 hours. Also monitor for manifestations of a distended bladder, which include the fundal height above the umbilicus, fundal displaced from the midline over to the side, bladder bulges above the symphysis pubis, excessive lochia, tenderness above the over the bladder area, and then frequent voiding of less than 150 milliliters. That'll indicate urinary retention. And then again, for client education, reminding them to void every 2 to 3 hours and drinking adequate amount of fluids. And then next is observing the lochia, which is the drainage. So what we're collecting here, well, there's 3 different stages. I don't know if you remember that from school. There's lochia rubra, which is bright red color. It has a bloody consistency, a fleshy odor, possible small clots. Transient flow increases during breastfeeding, and it usually lasts about 1 to 3 days after delivery. So she'll probably still be having some because she's 2 days postpartum. There's also lochia serosa, which is a pinkish brown color and serosanguinous consistency. It lasts from approximately 4 to 10 days after delivery. And then lastly, there's lochia alba. It's a yellowish white creamy color, again with that fleshy odor. It lasts from approximately 11 to beyond 6 weeks postpartum. And then how we determine the quantity, there's scant, which is less than 2.5 centimeters. There's light, which is less than 10 centimeters. Moderate, which is greater than 10 centimeters. Heavy is 1 pad saturated within 2 hours. And then excessive blood loss is 1 pad saturated in 15 minutes or less, or pooling of blood under the buttocks. So what we need to do is monitor the lochia flow for normal color, amount, and consistency. Expected findings would be the lochia typically trickles from the vaginal opening, but flows more steadily during uterine contractions. A gush of lochia with the expression of clots and dark blood that has pooled in the vagina can occur with ambulation. So maybe advise them to wear a pad or something while ambulating. Some abnormal findings of lochia would be excessive spurting of bright red blood from the vagina, possibly indicating a cervical or vaginal tear. Numerous large clots and excessive blood, which is again saturation of 1 pad in 15 minutes or less, can be indicative of a hemorrhage. Foul odor, which is suggestive of an infection. Persistent lochia rubra, which is that bright red color. In early postpartum period beyond day 3, which can indicate retained placental fragments. And then lastly,
That wouldn't be good.
No, not at all. We want to get rid of all that placenta. Continued flow of lochia serosa or alba beyond the normal length of time can indicate endometriosis, especially if it is accompanied by fever, pain, or abdominal tenderness. So what we need to do is, with any of these abnormal findings, is notify the provider, administer antibiotics if ordered, and assist with emergency care of clients. What we can educate the client on is notifying the provider of any abnormal findings once they're discharged. Okay? And then lastly here, comfort and rest. So we need to monitor the pain related to the episiotomy, which is the E in bubble. Any lacerations, incisions, after pains, and sore nipples. Determine location, type, and quality of the pain to guide nursing interventions and client instruction. And also administer pain medications as prescribed. And then following their hospital stay, so with discharge, what we're going to do is schedule a postpartum follow-up visit. Following a vaginal delivery, the follow-up visit should take place in 6 weeks. Following cesarean birth, the visit should take place in about 2 weeks.
So I'm assuming that she had a vaginal.
She did have a vaginal birth, yes. We're gonna provide written postpartum and newborn instructions for them to follow once they get home. And we're also gonna instruct them to report any danger signs to the provider. That being things like chills or fever greater than 38 degrees Celsius, which is 100.4 Fahrenheit, for more than 2 days. Change in vaginal discharge with increased amount, large class, and change to a previous lochia color, such as bright red bleeding and a foul odor. They need to keep an eye on their episiotomy for any lacerations, incision pain that does not resolve with analgesics or pain medication. Know any foul smelling drainage, redness, or edema. Pain or tenderness in the abdominal or pelvic area that does not resolve again with analgesics. Breasts with localized areas of pain and tenderness, with redness and swelling and or nipples with crack or fissures. Calves with any localized pain and tenderness, redness and swelling, a lower extremity with either areas of redness and warmth or coolness and paleness. So just keep an eye out for any symptoms of a blood clot. Urination with burning, pain, frequency, urgency, or urine that is cloudy or has blood in it. And lastly, feelings of apathy toward the newborn, inability to provide self or newborn care, or feelings that can result in self or newborn injury. Okay? Is there any questions that you have for me?
No.
Okay. So as a little reminder here then, you're going to perform a bubble assessment.
Yeah.